Hi, my name's Vic. Um, about a little over a year ago, I had to have open heart surgery, and kind of through a much longer story, I actually had to have open heart surgery twice in the course of just about 6 months. And I was really scared and apprehensive about it, and uh, now that I've been through it and survived, I felt like might be nice to be able to tell my own personal story, uh, because at least in my particular case, you don't have to be so scared. It's really not that bad, and I guess that's the primary, message I have. Now, I'm not a doctor. I don't know that much really at all about the heart or any of that, and I'm not saying that I do. You need to do your homework, and it's something else important through the whole thing is that you have to be your own advocate. You know, the doctors and hospitals have a lot of different people, and you've got you, so I don't know how to say it correctly, but you need to watch out for yourself and stay diligent. Again, I want to just say I'm not a doctor, and I'm not trying to give or medical advice in any way, because I'm not smart enough to do that, and you need to talk to your doctor about everything. But I just wanted to give you a little comfort level, if that's what I can give. So, as far as the surgery, they joke about does it hurt much, and I actually tried to look at a couple blogs and things before, and there's a couple jokes about the fact that while you're having the surgery, it doesn't hurt at all because you're sleeping. But in my case, I actually have had to have a couple other surgeries, and back surgery, and actually colon surgery, and I mention it because I can kind of give you a relative idea of pain and stuff, at least for me. And again, I've had a couple friends who've had this too, and all our stories at least have been fairly similar. And I had the full tilt. My chest was open both times. And there are other surgeries where they just go in orthoscopically with small incisions, and again, I think in my case they decided to go in through my chest, and here little this is the drum, and so it was surprisingly not that much pain. I mean, first of all, most places are doing pretty good about trying to give you pain medication now, especially if you ask for it. And it's not easy. It's a difficult surgery. I mean, you don't expect it to be easy, but it wasn't nearly the same kind of pain I had, for instance, when I had my colon surgery. So, anyway, again, because I've had a couple experiences, I can tell you the first time I woke up either after they took my breathing tube out, or I was so groggy and kind of out of it that I really don't really remember that experience at all, and it wasn't unpleasant at all. And I'll mention something. My wife came in to see me directly after the surgery, and if you have a loved one who's coming in, prepare them, because I think it's scarier than it really is. I didn't feel any pain, but you have things coming out of your neck and breathing, and my wife said I looked kind of stiff, and she was just, I think it really took her breath away. So that's the tough thing, and having a loved one go through that. Now looking back, I realize how it's tough on you, but it's even tougher on them in some ways. So you want to be careful to understand that and let them know that, not to be too worried about what they see at first, because it's just all part of keeping you alive, and it's all good. So anyway, the second time, I do remember waking up in intensive care, and that's where you are. Wake up the first time. I don't know how long. Again, I hope you would talk to your doctor about any of this, but I woke up and I still had the breathing apparatus, and I remember them taking it out, and they say it's not going to hurt, and it does hurt probably a little bit, or it's pretty uncomfortable, but only lasts for a couple seconds, and then you're groggy, and they're telling you to breathe, and you're breathing, and there's a lot of stuff going on, and monitors beeping, and that's one of the things I remember most, is there's a lot of noise and stuff going on and a lot of people, kind of trying to take care of you. So I guess that's all good too. But the first day you're in your own room, you can expect to have some pain. They cut open your chest, and or if that's the way they did it in my case, for open heart surgery, and but again. At least a couple of my friends and I have said that it's almost amazing how you sit there in the bed afterwards and you're thinking, I can't even believe what they must have done in there, because really, everything being in perspective, it's amazing that you don't feel worse, I'd say. So anyway, shortly after that, and you're going to have tubes coming out of you. I mean, you've got some drains and monitors at that point. Sometimes I think at least in my case, they had a monitor that was actually attached in there, and through little wires, and you have some things, and you have a bandage on, and it seems pretty amazing. But again, the good news is that it's going to be a short period of time before they have you up and walking, and you're having something to eat, and shortly after that, in the big picture, you're at home, and it's some slow going a little bit, but for the most part, you want to get up and get around. They want you to, and that's what's important. So anyway, I hope that I've given you some idea what it might be like, and to tell you that not to worry too much, that it's no minor thing, and everybody's experience is different, but at least in my case, I'm going to tell you, even going through twice, it wasn't that bad, and I mean, I'm happy to be here. So I think maybe after you go through the experience, you'll be happy to be here too, and whatever you have to do to get there seems worth it. But in this case, it really isn't even that bad. So at least in my case, I always came out of this feeling like I want to do what I can to help other people, and this is my own way of trying to help a little bit. So I hope I did, and take it easy. God bless, and good luck.